morning, it's 11:20 here in Seoul. I'm Oh Soo-young at the Arirang News Center. We're breaking into our regular programming to bring you a live briefing from the South Korean health authorities on the coronavirus outbreak here in the nation. In just a few moments, we'll cut into the briefing at the Seoul Government Complex with simultaneous interpretation available for you in English. There, Kim Gang-lip, Vice Health Minister and overall coordinator of the Central Disaster and Safety Countermeasure Headquarters, will be sharing the latest figures and updates on the COVID-19 situation in Korea. And it looks like he's just found his way to the podium, so it looks like the briefing is just about to begin.
Let us now begin our regular briefing for July 8th, Wednesday. As of today midnight, we have new local infections amounting to 30, and we have 33 new imported cases. And now the total number of confirmed cases stands at 13,244. And right now, 989 people are in quarantine undergoing treatment. We have no additional fatality as of yesterday, and the death toll remains unchanged at 285. This morning, KCC held a meeting presided over by Prime Minister Chung Se-kyun, and we discussed issues including the measures to tighten security and the quarantine for religious facilities, as well as the public servant screening test upcoming during the weekend. And Prime Minister Chung Se-kyun also said that we are seeing increased cluster infections centering around churches nationwide, as well as small religious group meetings, and he urged for the participation by the religious circles. And he also said that the EU has allowed the entry of people from South Korea. However, he said that the people of South Korea need to refrain from going overseas because the conditions abroad are very grave. Recently, we are seeing increase in the number of cluster infections, especially in the metropolitan area, and we are seeing a decrease in the metropolitan area on a daily basis. However, we have sporadic infections at the Jeolla provinces as well as Chungcheong area, and we are seeing a decrease in the large cluster infections. However, we have continued to see sporadic infections, especially at small facilities and small religious group meetings. To this end, Gwangju and Jeollanam-do province has upgraded its level for the distancing measures for level 2, and the central government is also providing its full support to support the local municipal governments. Nevertheless, it is most important that the members of the public continue to have proactive understanding and participation. As for the city of Gwangju, starting from July 2nd, after the intensifying of the distancing measures to level 2, we have seen about a 39.9% decrease in the mobility rate of the mobile communications, and there has been a decrease in the foot traffic. And to this end, we would like to thank the citizens of Gwangju for your active participation. Thanks to your support, the trends in Gwangju and Jeollanam-do provinces are currently on a steady decline. And like this, if we join efforts with the public and the central government, we believe that we can curb the virus going forward. Next are some of our measures to intensify quarantine measures for churches nationwide. Up until now, thanks to the proactive participation by the religious circles, we believe that these religious facilities have complied fully with the core quarantine protocols. However, there continue to emerge the small religious group meetings, especially at the metropolitan area and the Jeolla provinces. And therefore, starting from the 10th of July, we will be mandating all of the churches nationwide to mandatorily comply with core quarantine protocols. Instead of designating all of the churches as high-risk facilities, all of the regular services will be carried out as normal. However, they need to comply with the basic quarantine protocols, including wearing a face mask and checking of the temperature, as well as keeping distancing. However, we will be prohibiting all of the gatherings, including small gatherings, events, and joint meals. So these need to be complied, as well as the entry log that needs to be kept mandatorily. And if there is a breach of quarantine measures, not only church members, but also the staff members will also face with fines. And also, as for the religious facilities that have turned their services to online services, we will be easing these facilities with the administrative ban on the gatherings. However, if they continue to breach these quarantine measures, they will be under the gathering ban by the government. So we continue to ask for the participation and cooperation by the religious circles going forward. Next, we have some risk analysis for our daily routines. As mentioned before, not only our religious activities, but also other routine daily activities, individuals need to continue to stay vigilant and refrain from doing risky behaviors. To this end, the government has designated some of the categories into 12 large categories, including dining, sports events, as well as religious activities. And we have assessed all of these categories as high, medium, and low risk. For instance, all of the religious facilities need to wear face masks. However, there is a large increase of the travel of respiratory droplets. Therefore, they need to refrain from singing and shaking hands and eating together to maintain the risk level at medium. However, when they gather together and they sing and they eat together and when they shake hands, we note that the risk of infection is actually very high. When we look at the actual examples, when there were cases where churches carried out joint singing and gatherings and eating, there has been a large increase of the infections. And as for dining outside, we have the basic principle that dining outside in the restaurants, especially indoors, is also high of infectious risks. However, if people eat outdoors and if the facilities is well ventilated, and if they take out their food and eat indoors inside their homes, we believe that these will lower the risks of infection. And if the public goes to the buffet restaurants where they share the utensils, we believe that these facilities will be will have a higher risk of infection. So to the many diverse categories of our daily routines, we have categorized them into the different levels of risks, and we have also disclosed our measures for each of the detailed quarantine for each of the facilities. So we ask the public to continue to engage in the activities that only have a lower risk of infection. And especially if you have high contact with others, including those in the vulnerable class, we also advise you to comply with these measures going forward. Next, we have some guidance for our dining culture, and the government is exerting full efforts to continue to do an inspection of the restaurants nationwide. And to this end, the Ministry of Agriculture is appointing and designating restaurants that comply well with the quarantine measures as public relief restaurants. And centering around these relief restaurants that are best practices and best examples, we will continue to discover them, and we aim to find about 20,000 of them nationwide by the end of this year. and we will give out stickers, and we will also provide special support for these best practices of restaurants. And the Ministry of Food and Drug Safety, we are also advising the revision of the culture for dining out, as well as the practices that are carried out by the operators of these restaurants. We will continue to revise these dining cultures going forward. And at this morning's KCC meeting, we also dealt with the issue of the test for the national public servants screening test that is scheduled for this Saturday, July 11th. And we have already conducted similar testings at May and June, and we have carried out these testings for about 400,000 test takers, and we believe that this test will also set a very good example where we can curb further spread of the virus, and we will continue to prepare fully, especially in the metropolitan area, Chungcheong, as well as the Jeolla provinces, for which have increase of the local infections. We will make sure that there are no cases of infection and keep these test sites safe. And at a time when the battle against COVID-19 is becoming a prolonged one and something that is inevitable for us, we need to revamp our daily guidelines, especially cultures for dining out and engaging in religious activities. All of the activities that have been deemed normal have now put ourselves at higher risk of infection. And together with the experts, we will continue to consult with the medical as well as the academia. We will continue to discuss the measures for the COVID-19, and we will also increase our analysis of these COVID-19 outbreaks. And up until now, we have carried out about 5 times of such similar seminars, and we will continue to open our ears to the public as well as experts, and we will set good guidelines and effective guidelines for the public to follow. So we ask the proactive participation from the members of the public. Thank you very much.
That was Vice Health Minister Kim Gang-rip briefing us on the coronavirus situation here in the country. He just told us that there were 63 new infection cases of COVID-19, bringing the accumulated total to 13,244. There were no new deaths, however, meaning that the death toll stands firm at 285. That wraps up our coverage of this morning's briefing. Thank you for staying with us, and we'll be back very shortly with our regular midday news. Bye for now.